I'm Jim McMahon. I'm an associate professor, School of Nursing, University of Rochester. I got into HIV because I was on this original study looking at how women were becoming infected. And the results that came back from the study indicated that most women were becoming infected from their primary partners, their husbands or long-term boyfriends, which was kind of a surprise to us and most other people working in the field. And in the sort of the mid-1990s, we had a major breakthrough with highly effective antiretroviral therapies that really transitioned HIV from a fatal disease more into a chronic disease. So that really focused my research on couples, particularly heterosexual couples where one partner is infected and the other is not. And so trying to prevent infection within these high-risk heterosexual couples. Back when I started this work with couples, the only effective prevention method was condoms. And intimate partners, married couples, they just don't like to use condoms. So it was really challenging to try to develop programs to prevent HIV within these couples. Now we have pre-exposure prophylaxis and U equals U, so there's a lot more tools. And that's what I'm really focused on now, is trying to get couples aware of these new methods and develop programs to get them to optimize their prevention. So a few years ago, I co-founded a research group called the School of Nursing Interdisciplinary Sexual Health and HIV Group. And it's been a really great experience because we have a lot of young new investigators coming up, and we all collaborate on projects together and review each other's work. I think the most rewarding thing about my work is when I hear that it touched actual patients or the community in some way. So I know that an HIV counseling and testing intervention that I developed a few years ago is now being implemented in different sites around the country. So I know that will help directly impact people and couples to prevent HIV. Yeah, the goal of ending the HIV epidemic nationally and globally is something that we just really recently started to talk about. Now we're really optimistic that we can end at least the epidemic nationally with these new methods.